Good afternoon and welcome to the Leadership Link and Learn webinar series. This is an event hosted by Health HIV as part of our ASO and CBO Leadership Initiative. Today we're joined by Dr. David Williams from True Simple, and he is going to be talking to us today about what is leadership in healthcare today. Just to give you a little bit of a background on Health HIV before we get started, we are a national nonprofit that focuses primarily on HIV, hepatitis C, and LGBT initiatives. We have 4 core capabilities in capacity building, health services research and evaluation, advocacy, and education and training. And some of our capacity building programs are listed here. Today we are doing the Leadership Link and Learn series as part of our ASO CBO capacity building programs, as well as the HIV prevention technical assistance programs. So you can see the logo there. Why do we say we do 3D HIV prevention? It's mainly because the program enhances the ability of technical assistance recipients to conduct enhanced data collection and analysis to make better informed programmatic decisions that impact the delivery of quality HIV prevention services. And our approach is to facilitate community infrastructure development and systems coordination, expand care team integration through partnerships between non-clinical HIV prevention partners and clinical HIV prevention partners, demonstrate cost effectiveness and outcomes monitoring of programs to maximize strengths and efficiencies, and to promote workforce development, including training the next generation of leaders in HIV prevention. And that's part of the work that we're doing here today with our Leadership Link and Learn webinar series. Our ASO CBO Leadership Initiative was launched early last year in 2014 and focuses primarily around our leadership training and certificate program. This is a program that has 6 modules. And is completely online and self-paced, and we'll share how to access that in just a moment. The other pieces are Link and Learn monthly webinar series, which is hosted once a month, and it's a 1-hour lunchtime webinar series hosted by different leaders in the ASO and CBO realm. Our mentor-mentee program, where we match mentors and ASOs with mentees, and an online portal that links ASO and CBO leaders around the country to engage with one another, share information and best practices, and participate in online education and training. If you're interested in becoming a certified ASO leader, you can access the Leadership Training and Certificate Program at the URL here. Again, I mentioned before, we've certified ASO leaders across the U.S. With this 6-module program in a variety of different topic areas. And you can see here, we've reached actually over 120 leaders thus far and certified them through this leadership program. But you can see here just a few of where some of your colleagues have already accessed the program and become certified. We're also launching this series. This is the first of the Leadership Link and Learn series. As I mentioned, it'll include monthly webinars. And if you're interested in the ASO CBO Leadership Training Program, again, you can access our guide, which is available for download now. The slide deck for this webinar, as well as the recording, will also be available on healthhiv.org. So without further ado, I'm going to turn it over to David Williams, and he's going to start his presentation on leadership in healthcare today.
Great, thank you very much, and it's a pleasure to be with you today and to talk about this important topic. So in the context in which we're going to proceed, we're actually going to talk about the idea of quality as a strategy, or building quality into the way in which your organization pursues its activities and learns and builds towards serving your clients. just to give you a little bit of background about myself, I am an improvement advisor and improvement scientist by background, and focus in on trying to bring improvement science into various different disciplines, including education, public safety, and healthcare organizations here in the States and abroad. By background, from a clinical perspective, I started my career as a paramedic in the United States and have studied ambulance systems for more than 25 years, and also work on the board of the local federally qualified health center system here in Austin, Texas. So when I describe and come at talking about quality as a business strategy, I often draw from a number of these different backgrounds. So for those of you that may or may not be familiar with using WebEx or seeing WebEx, we're going to be having slides that instruct you to look at the chat box or to contribute to the chat box, and if that's an option for you, please feel free to do that. And if not, I'm happy to have you write it down on a piece of paper and follow along as we go along, because there's a number of different places throughout that we'd like you to interact down here and share with participants. So one of the first things, if you're online, is to be able to share your organization and the number of people that are participating with you today. Great, and we've got people from all across the country. I'm here in Texas, and so if you have the ability to, feel free to click on the map and show where you're from, and obviously we see we've got a diverse group of people from across the country, which is wonderful. So I mentioned that we're going to talk about this idea of quality as a strategy or as a business strategy. And as part of doing this, our objectives are really to focus in on 5 key activities for leaders. That includes thinking about your purpose, mission, vision, and beliefs, viewing your agency as an organizational system, thinking about the system that you use or have for obtaining information. I often call this the customer focus, and then using this information in a way to plan for improvement. And then, of course, improvement requires that we have some kind of methodology, some way of managing improvement efforts. So each of these activities will be discussed as we go along and think about the idea of bringing quality in as a strategy. Before I begin, I want to sort of emphasize, I mentioned earlier that I come at looking at this work through the science of improvement. And the science of improvement is a blend of a number of different components that bring us together to some very pragmatic approach to enable us to improve systems. And this is an example. It comes from a paper by Provost, Perla, and Perry, where they talk about the 7 propositions that sort of provide the philosophical and theoretical base for improvement. And then we blend that with the system of profound knowledge, which we take from Dr. Edward Deming's work, where he focused us in on thinking about appreciating systems, appreciating our theory of knowledge and how we build understanding, our understanding of using data to appreciate variation, and then also recognizing that these often are human systems where psychology plays a role in our incentives and in our motivations for change. And this leads us to looking at very specific improvement methods, which, as I mentioned, is the 5th activity, or part of how do you go about trying to create improvement by marrying that up with subject matter experts. And that results in what we would call the characteristics of the applied science of improvement, a number of different things that come along as we actually apply this science going forward. This is sort of the foundation which is underneath all of the work that we're going to talk about as we go forward, and it's a number of different factors that helps us to appreciate that there really is a science to thinking about improvement of organizations and systems. Now, the 5 activities that we are going to describe, or the quality as a strategy has its roots in something that I mentioned, which is Deming's production viewed as a system. This is an example of that view of a system that Deming had created. The original version was actually in his book Out of Crisis, which is one of his famous publications, but this particular draft actually came from an adaptation that was in a book called The Improvement Guide, and it is based on trying to provide a little bit of more description that shows you the various parts. Now, as you see here, the middle part describes how work happens towards achieving the customer's need. On top, we have various activities, including understanding that need through customer-focused research and improvement, and designing that into how we change the way that we do our work, so that, again, we are constantly improving the system to meet our customers' needs. And then underneath that, we recognize that there's a bunch of different supports that enable us to do this work. Now, the way that this has been articulated in terms of thinking about it as activities for system improvement is described here on the screen as 5 activities. And we're going to go through and talk about each of these 5 activities in a little bit of detail, and also show some examples from some organizations that have applied this kind of thinking as a framework for taking a systems approach to improving your organization towards quality. The first one is a focus in on the purpose, mission, vision, and beliefs of your organization. And this is an area that I often sort of comment on from my experience in almost every organization that I've ever been in. If I ask you, do you have a purpose statement or a mission, vision, and values, almost everybody's going to say yes. Many of you may even have it framed on the wall in the hallway or an office somewhere. Some of you may have gone through an exercise that you have it, but you don't know where to find it. And what I find is that in general, most people have gone through some degree of an exercise to create these. But the big difference here is that in the context of improvement, Dr. Deming used to describe this idea of having a constancy of purpose, a very, very clear focus in terms of what are we trying to accomplish, and some direction in terms of how we will go about that. In an organization that's focused on quality, the purpose, mission, vision, and beliefs are steered in such a way that they really, really do describe what is the vision of where you want to go, what are the values that you will use as you go about that process, and what is the clear mission of the organization. And this is just an example from one organization that tried to articulate this for themselves. And why this is important is this shouldn't just be something that when you're done you check off a box and you frame it on the wall or file it in a shared drive. This really should be a series of key driving guidance pieces that you can use every day that very, very clearly help you figure out who it is that you serve and who it is that you do not. And as you go about that service, what are the things that matter to you? So when you say something like teamwork, how do you articulate or practice teamwork within your organization? How do you truly make sure that teamwork is embedded into the process? Or when you say that you're about quality, which is probably one of the most common values or even mentioned in mission statements, how do you actually describe and articulate that quality is happening, that you are focused on quality, you're focused on reliability and reproducible service? How do you do that, and how do you embed that into the work that you do? So this first activity around focusing in on your purpose, mission, vision, and beliefs is really serious in terms of providing that guidance, that sort of clear piece where everybody's on the same page, that this is what we're doing and this is how we're going about doing it, and then we can use it regularly to make sure that as we do activity, we're focused in on doing our work to achieve these aims. Very, very important. So I want you to think about for yourself, how is your mission, vision, and values embedded in your organization? How does it affect the way that people lead and work? And do you even know where those mission, vision, and values are? Are you familiar with them? So think about that for yourself, and I encourage you to pull out your organization's mission, vision, and values, and really think about how, whether that is still relevant, that they make sense for your organization, and you and your peers would look at that and go, yeah, this is us. But also, are you actually embedding each of these components in the work that you do each day? Real key piece for this first activity. So the second activity is an interesting one, and it goes back to that systems map that I was showing you, the production system from Dr. Deming. And so when we look in here, we're trying to figure out how do we view an organization as a system. Now, this is an example, and it actually draws from many of the same positions and names you might have seen on the production system map from Dr. Deming. But this is a traditional view of an organization that if I were to walk up to you and say, how does your organization, how is it organized, how does it work? Most people will pull out a hierarchical view like this, an organizational chart. And what this does is really not tell you about how an organization works. It shows you the flow of responsibility by position. And so it doesn't tell us a lot about what's working, what's not working, and how it works and how it flows together, but more who's responsible for this. And the reality is individual positions can be engaged in various parts within the system. And so it doesn't provide us the full picture of how work gets done and how processes exist within a system and how they're linked together. So as you're thinking about your organizational chart, does it truly match the way that work gets done in your organization, or is there another way to think about how work operates within the organizational system that you work? And so this is that same chart, but then portrayed as a system of production. And so now all of a sudden you see the names, but you realize that people have ownership of different parts. For example, here Mrs. Bragg has a responsibility related to suppliers, has responsibility related to support processes. There are various elements where work happens and happens in a flow that we're trying to figure out how to make reproducible and with a high degree of reliability, and there are various people that are involved in the process and the system of getting that done. So it's important for us to understand how this system works for an organization to be able to understand how processes are linked and how we have one process produce for another process and who the inner organizational sort of producers and customers are, and then also how we learn about and improve that process. Now, one way to look at this is to break it out into appreciation of different types of processes. So in this particular example, when you look at that core stuff that is the service that you're providing every day, this can be very easily described as the mainstay or core processes. When you think about the activities below, the things that make those processes happen every day, like staffing and payroll and professional development and all those kinds of things, these are things we call support processes, and they are things that are absolutely important. They're not critical to producing on a day-to-day basis the primary service, but they enable that service to occur over time and enable the people that are part of that service. And then on top, and we'll talk a good deal about this in a number of the different activities, are driver processes, things that help us to understand the need of our customers, help us to do research about our market and environment, and take feedback from the activities that we're already doing so that we can plan to improve and redesign the services and processes that exist so we can better produce service or product for our customers. The real key piece of understanding this sort of systems view of how all work comes together. And how it's not siloed as one. So I want to show you an example of how one particular organization, this is actually an ambulance service in Charlotte, North Carolina, started to try to articulate for themselves how this worked. And this is an example on a whiteboard where the leadership of this organization very much tried to match the diagram that I showed you on the previous slide and used Post-it notes as a way to describe key processes within their system that enable them to serve customers and to understand need. And this is often one of the first places and best ways to do this process, is actually trying to have people to map out how work gets done. For those of you that have ever done quality improvement work, you know that, for example, using a process map or a flow map or value stream map is a powerful way to empower people to understand how a process works or doesn't work. This is the same thing, but at a broader organizational system level. You're basically describing the linkage of processes across your organization and how they're all connected so that you can see how work gets done with your organization. This is a later version of that same map where they actually used a program called Visio, and they started to articulate this more concretely. And so for them, as you look at this here in the middle, this is the mainstay processes, and the key processes that happen every single day is they try to predict and produce the ambulance hours that are available to be able to serve the patients in their community and provide good clinical care for their customers. Underneath that, there are a number of different support things that help them make sure that they've got the materials and the equipment and the facilities and the staffing all worked out. And at the top, they have a number of different drivers that enable them to learn about what it is that from both the research and understanding their own data and their performance, what it is that helps them to improve the system, and what are the things that enable them to do that, especially here in this case from a staffing perspective. And one of the things you'll note is that as maps are made, as people start to think about how work gets done and map it out, while many people will start in something that looks similar to Deming's original drawing, the final maps that make sense for folks as they really look at their organizations will vary by organization, because the key concept here is that this map of your organizational system matters for you, that it makes sense for you and provides a view that helps you to understand how work happens and also how work is linked together, so that you can then focus in on understanding the reliability and variation that exists there and improving those processes and linkages. So obviously tied to this is the second piece. So it's one thing to know that your organization is linked and how you view it as a system, but then you also need to appreciate, how do I understand what the key measures or family of measures are that will enable me to understand how the system is working. And this is just an example of a number of different measures that might be thought of in a hospital system. But the idea is that you, by looking at the organization viewed as a system, you then pull out from that and say, well, if this is how work gets done, then how do I look at information and performance data that enables me to appreciate the work that's occurring? What are the key outcome and process measures that allow me to get a full dashboard of all of the things that matter in the linkages? And one of the things that's frequently happens is when people go through this process, they start to see relationships between various measures, and they display them. This is a great example of a small multiples dashboard that shows or profiles a host of measures, and they're all displayed in Schuhart statistical process control charts so that we can understand the variation and see improvement. So there's a high degree of information here. But now, as I'm looking at my system, these are all tied back to key activities and key processes within that system that enable me to be able to watch the whole organizational system operate across a number of different domains and do so in such a way that I can see linkages and appreciate how the performance in one may influence the performance in another. And this is a critical piece for enabling you to have data to support understanding variation and understanding the relationship between different processes in your system. So I want you to think about for yourself, how do you report data in visual displays that support understanding variation and building knowledge? And examples of that might be run charts or Shewhart statistical process control charts. And I want you to think about that because it's very, very common for organizations not to display data in visual displays like the ones that I just showed you here, but instead they show them in tables or individual numbers. And in doing so, you dramatically reduce the amount of insight and knowledge that you can gain from the data that you have. And so something to be very mindful of, as soon as you're able to take data and look at it over time and look at it in something like a simple line chart or a run chart or a Shewhart statistical process control chart, you dramatically enhance the amount of insight that you can get from those that process and outcome data, and it enables you to really see whether the work that you're doing is resulting in improvement or if the reliability and variation is not where you want it to be. So it's something to think about as you're going along and looking at your organization's use of data. And then are those measures that you're using, are they tied back to the key processes that matter as you're thinking about your organization as a system, right? Very, very important. So now I want to focus our attention on activity number 3. Now this is having a system for obtaining information. It's a customer focus. Now, I have yet to find a manager or a leader of any organization that will admit to me that they're not customer focused, that they don't think about the people that they serve, and that their desire isn't to achieve the aims for the people that they deserve. That said, I've found many organizations that don't actively search out understanding what it is that the customer needs from their own experience with your service, as well as doing analysis of the gap between the results that you hope for your customers versus where they are, as well as continually looking to understand how things are changing, either in the medical literature or best practices or whatever, that might influence the way that we need to change the way that we work. You know, something as simple or complex, depending on how you look at it, as the Affordable Care Act. It's a great example where it transforms the way that we're thinking about delivering services, and we need to be thinking about how that's changing it for the customer, changing for us, and model our activities in that way. And so the system for obtaining information is really a process in which we say, how are we going to do a scan with frequency that enables us to continually learn about the environment that we're working in, the patient population or the population of folks that we're serving, and changes that exist and that may influence our practice. And so this is, you know, the images here on the screen reflect some of those pieces. It came from an example here in Texas where I'm based. It includes thinking about looking at things like literature and, you know, what do we know that the state of the science has changed around the population that we're serving. Things like recognizing how the healthcare marketplace and the change in access and type of insurance alters our population that we've been serving. How does that affect them or not affect them? How does that affect us? Looking at changes in the system. In our particular case here in Austin, we've got a new medical school that's in process, and with that may come transformations in the way that patients get served and the way that things happen in our community. What does our community know about our population? Are there, you know, is there data and information that can inform us in terms of understanding the context of what's going on? And then are there other things that are going on? This is an example in Texas of something called the 1115 waiver, which involves a bunch of different projects that are focused on transforming the delivery system that are influencing the way that services are being delivered. And all of this scan, including talking to folks like customers and talking to suppliers and other partners, are important to do with frequency so that you can come together as an organization and say, what are we learning and what are we hearing about the way that there are changes in our environment and changes in what we're doing that we need to be responsive to, that we need to think about, that we need to improve. And all of this information is dramatically helpful for us to be able to transform our thinking and move away from our perspective as a service provider and looking and trying to interpret or predict what we think might be needed, to actually doing an active process that enables us to really take in some information and really try to understand what's important, what matters, and where we may need to change. And this can be a hugely powerful process. I encourage people to do it and engage as many people as possible and as many resources as possible, so that you have information, you have things that help improve and enhance your knowledge about what's important, and that then enables you to really think about how you refocus your attention. So I want you to think to yourself, how does your organization scan your customers in the environment to understand their needs? Is it a deep process? Is it multifaceted? Does it involve you getting a lot of input? Is it done on a regular basis? How do you go about doing it objectively and making sure, too, that you're not biasing that learning, that you're not just asking specific questions, but you're generally trying to understand what's going on so that you can use that as a mirror up against your own organization to make sure that you're headed in the right direction and doing the right things. And why this is important is because this then takes us into another piece, which is something that each of us should be doing at least annually, if not more frequently, is the idea of planning. And planning is different to me, and in this context, than just traditional old strategic planning, right? So most of us have gone through, similar to when we learned about mission, vision, and values, have gone through a process where we did strategic planning. And maybe we sat down and said, here's what we want to accomplish in the next year, here's what we want to accomplish in the next 3, the next 5 years, and we may have put some statements in terms of the aims that we want to achieve and put a name of who's responsible, and maybe even set some deadlines and goals, and these are very traditional strategic planning processes. And frequently, what I find is some people use them as roadmaps, other people pull them out at the milestones and look at and sort of retrospectively compare whether the day-to-day operations they continue to do achieve the milestones or not, and then there's sort of an explanation of well, this is what happened, or that's how this happened. But in this particular context, in this activity, for a leader that's really pursuing quality, what we're doing in the planning process is actually taking information that we have from our measures and taking information about what we know about our system, thinking about our mission, vision, and values, and then really pulling data from that customer-focused exploration that we did and using it in a way that helps us to figure out what is our strategic aim for continuing to meet our mission, for improving our system, and for improving the results that we get in our measures, at the same time that we engage and blend in the information that we got from our environmental scan. And this helps us to create a series of strategic objectives that are tied to an organizational strategy about what is it we're going to do that is our theory for how we can tackle this work. And frequently, this results in a portfolio often of projects that are made up of several projects, programs that may be made up of several projects to achieve the programmatic aim, and in some cases, independent projects. But all of these are a portfolio of things that are very clearly defined and aimed at achieving the mission of your organization and addressing what's understood from the customer-focused research that you did, as well as appreciating where your organization has opportunity from its data and from your systems view of improving. And this then becomes a real work plan, a real methodology for you to then be able to follow through on in trying to improve and enhance the organization to meet the aims for your clients. So I want you to think about, how often does your organization develop strategic objectives? Is this something that you look at quarterly, annually? Is it something that you only do every few years? And how might you change this to make this a more frequent and active process that really blends in some of these other activities that we've been talking about? And then tied to that, I really encourage you to think about what's the data that you use to guide your planning. Do you pull on that vector of measures, the data data over time about the key specific core processes within your organization? Do you pull in qualitative data from that customer focus and really scanning the literature and talking to the people that are your partners and talking to the people that you serve, and pull all that information in to be at the front end and to use it in a way that informs you thinking about the development of these strategic objectives. And I encourage you to think about that and think about how might you be able to change the way that you do your process to better accomplish that as you go forward. It's a powerful process and highly worth the time and investment. It makes it a much more rewarding experience as well for yourself. So the final piece that I want to talk about as we think about these activities is, so it's one thing to know where you're going and to know how the system works and to now have this information about the environment and the customer and have embedded that into your strategic objectives. But the biggest piece then is how do I execute on this? How do I, as an organization, actually focus in on trying to improve the results of the work that we're doing? And so in order to do that, you've got to have some kind of improvement methodology, some kind of shared theory about how improvement is going to happen. Now, there are a number of different descriptions of theories, from Lean to Six Sigma to just general use of the science of improvement, and any of these are appropriate as long as they draw attention to focusing in on clear aims, draw us to think about what are the changes that we think we can work on, help us then to also appreciate the measures that will let us know whether we're doing a good job, and then the result in you focusing in on creating reliable process. In this particular example, I'm going to focus in on one particular method for doing improvement projects known as the model for improvement, and that involves three particular questions, and it ties it in with an iterative testing process that allows you to test your way into learning. And I'll briefly describe that. And those of you that are familiar with work that's been done through the Institute for Healthcare Improvement or the National Health Service in the UK are probably familiar with this model for improvement. It comes from a book called The Improvement Guide, which you've seen some references to throughout this PowerPoint presentation. And it basically involves us asking three questions before we tackle any particular project activity. And these three questions are hugely powerful in anything that you do, so you can use them in any meeting or any context. The first one is, what are we trying to accomplish? And you'll see over here on the right-hand side, these are actually examples from a large ambulance company in the United States that was trying to work on out-of-hospital cardiac arrest survival. And so here, what they did is they described what are called very, very clear aim statements that describe what it is exactly that they're trying to do, by how much, and then by when. Very, very clear definition in terms of the what you're changing, by how much you're going to improve it, and by when, so that you can plan around that. And then tied to that, they say, well, gosh, if those are my aims, how will I know that a change is an improvement? And they do that by identifying outcome and process measures that are tied to these aims, and they look at them over time as a family or a system of measures that enable them to see the results of improvement as they're working on each of these key processes that are important to achieving their aim. And then the third question is, what changes can we make that will result in improvement? And this is an example down here of a driver diagram, which is basically a visual display of their content theory, and it's very directly connected. Each one of these drivers is tied to a measure which is tied to an aim, where they've basically articulated a family of ideas across different key drivers of the process they're working on that they can work on, test, and make reliable. And if they are the things that matter, and they are the things that are tied to the key drivers that will produce the aim, they can expect that by working on these key processes, they'll eventually influence not only the process reliability measures, but the outcome measures, and achieve their aim. And the core engine they use for that is something called the Plan, Do, Study, Act cycle, which is a very, very simplified version of the scientific method, which basically involves people making a plan to test a change, actually doing that test of change, and then coming back and studying the results of the change that you tried, and then acting on what you learned. And often that involves you planning another test. And that creates a process where we have cycles of tests or iterative learning of PDSAs that are happening and helping us build knowledge. We use the 3 questions as a way to frame what it is that we're going to work on, and that then produces a number of different hunches, theories, and ideas. And we start by conducting very, very small-scale PDSA tests that may involve us working with one client or with one worker or with one activity, and slowly building knowledge one test after another until we figure out what works. And then from what works, we can use PDSA testing to help us to spread that activity across our organization and also figure out how to implement it so that it permanently creates changes that result in improvement. It's this sequential building of knowledge over a wide range of conditions that really enable us to create a solid process that works, that achieves our aim. And so this is how, in this particular case, the model for improvement incorporates these 3 powerful questions with the plan, do, study, act cycle that enables us to do this iterative learning towards improvement. And that's one method in which you can act on all the various things that come out of your process and of all the areas within your organization that are opportunities for improvement. So I want you to think to yourself, what's your method for continuous improvement in your organization? Do you have one? Is there one? And if not, it would definitely be worth learning one or finding one that's accessible. The model for improvement is a great example of one that's very, very accessible and easy for most organizations to deploy, although there are others as well. You may find that there are partners or others that you work with that use a method and may have some knowledge to share and build, but it's important as a staff to have a sort of a uniform way in which you tackle improvement, and having a uniform method like the model for improvement can be very, very helpful in terms of your progress towards improvement. So as we look at this, we've gone through each of these 5 activities for leaders. We started by talking about the importance of being really, really clear, the constancy of purpose of what it is that you as an organization are aimed at doing, and wanting to not only understand what it is that you're doing, but how is that embedded in the way that you do work, and especially the beliefs or values in which you execute on work. We talked about understanding your organization not as a hierarchy or as an organizational chart, but actually as a system that views how work actually happens with core mainstay processes and driver processes and all those support processes. It doesn't list it here, but we talked about the need then to have a vector of measures or a core family of measures that help you see data over time displayed in a way that visually shows you the performance and variation that exists across these processes. And those are all important as you go into a frequent scanning process that looks at trying to obtain information and specifically about the environment and the customers that you serve, so that that insight can inform how you look at delivering services every day, as well as how you look at improving services for tomorrow. And those drive into the process of planning and really developing very, very clear strategic objectives and improvement efforts, and deploying the resources to meet those on a frequent basis that provides you with that strategic process that enables you to actually focus in on improvement. And then finally, there is the need to have a way to manage improvement efforts within your organization, whether that's the model for improvement that was described here, or methods like Lean or Six Sigma or others that enable you as an organization to have a shared approach and methodical way for taking action on improving the results and processes that are within your organization. One thing that might be helpful for you, this is a grid that was actually created by the Associates in Process Improvement and the Institute for Healthcare Improvement, and it actually goes through each of these components that we talked about and talks about various descriptions that might enable you to see where you are in relation to being not very mature to being very mature in each of these activities. And they actually break the activities out into a couple of extra spots, but you can go through and say, gosh, as I think about my purpose, mission, vision, and values, which of these definitions best matches where I am? And the aim is to be as close to a score of 10 across all of these, and recognizing that that's not unlikely or it's not likely that anybody is. But when you go across these definitions and you find areas where your scores are lower, those are great opportunities to connect with your staff and your colleagues and say, is there an opportunity for us to enhance this particular activity within our organization, and try to work on bringing each area up to a score of 10. So with that, I'm going to stop and conclude our content for today. I want to thank you for your participation and your listening, and welcome you trying to think about this content and applying it within your organization. And I'm going to stop and hand it back to Marissa, who's going to close us out for this session. So thank you.
Thank you so much, Dave. That was really great and very informative. As I mentioned before, I just wanted to let everybody know again that this webinar is available for viewing online. The PowerPoint slides are available on the Health HIV website, and this recording will also be posted on the Health HIV website. And you can go to www.healthhiv.org /resources to find our variety of different webinars that we have, as well as the recordings. Our next webinar series webinar for this particular series will also be posted on the Health HIV website, and an announcement will go out. We will be having our next webinar in May, and that is also going to be posted on our website. If you're interested in any additional capacity building, please feel free to contact me. If you have any questions for Dave, also feel free to contact me, or you can tweet him. I think I saw his Twitter handle pop up at one point. So feel free to contact us if you have any questions about this presentation, and feel free to contact me, Marissa Snelly. I am the Senior Capacity Building Manager at Health HIV. You can use my email or my phone number there to contact me about capacity building services, our 3D program, and any questions that you might have about our ASO CBO leadership initiative. So thank you again so much for attending, and we look forward to your feedback.